We wanted to work with the Virginia Mason Institute because they have a worldwide reputation for applying the principles of lean to a healthcare setting, and the Virginia Mason production system has become a worldwide benchmark for the application of lean methods in healthcare.
It's similar in the way that it teaches tools, but where it's different is that it tells the people to actually go out to where you work, your Gemba, what's your workplace, and work with the people who are in that area to empower them to come up with ideas and then make those changes.
Letting them lead from the bottom. The junior staff talk about it amongst themselves, they see things happening, and that then inspires the other ones to get involved because they can see that things will change and their views are absolutely taken into account.
So the tools and techniques are actually a really small part of our improvement processes, and actually the cultural part is far more important. So do our staff members feel able to really improve the care they're giving right where they're doing it? Do they have the space and the opportunity and the freedom and the support from the leaders in the organisation to really sort of challenge what we're currently doing and make improvements?
What really impresses me about the work that we've done with BMI and our own version through Snatch Plus is how it inspires staff to actually think about what they're doing and do things differently.
Within each team, it's important to us to get people trained, to get the improvements done, so teams will make sure that those people are released. And all of our line managers are aware that they need to support their staff to get the time needed to go and do those improvements.
Lean for Leaders is a 6-month exposure to the tools and techniques that we're being taught by Virginia Mason, and allows our leaders in the organisation, not just those that have a significant responsibility, but those that are actually involved in the delivery of care, to be able to be exposed to those tools and then take them back to the workplace and be able to make changes themselves.
It's important to say that patients themselves have been involved in the improvement work. So we've had patients getting involved in the rapid process improvement workshops. They've been able to make sure that their priorities and the issues that matter to them are part and parcel of the work that we do to make improvements across the service.
I went along for the best part of a week and helped in the detail, nitty-gritty of taking apart the process that was the existing process and looking at where we were and how we could improve it.
It's those activities that we do every day that we don't necessarily add value to what the patient experiences. So what this does is get to the heart of that, which means we'll be able to deliver better services, faster, more efficiently and cheaper as well.
There is no better feeling than knowing that you are making a difference.
One of the things I've been looking at is the amount of times a nurse comes out of the bay when she's looking for equipment while she's admitting one patient, and by putting a tray in a drawer next to the patient with everything they need in, I've saved 8 hours per week.
I am leaving them to come up with their own ideas a lot more, so they're giving me ideas to better things that they are actually physically doing.
As you can see behind me, all our items are marked, labelled. We have an inventory that we know the minimum and maximum level, so we never overproduce, nor do we ever run out.
The most interesting thing that it's done for me, most of all, and I know for many of our staff, is that every day we find out what we don't know, and we find and learn new ways to do things.
One of the things we do at the end of any quality improvement project is the whole team gets together with interested parties from around the hospital in what we call a report out, and they'll talk about their successes and everyone can sort of celebrate that together and see what great results people have had, and that really creates a good buzz and energy that people take out back into the organisation.
If you're serious about organisational change, if you're serious about wanting to be a world-class institute, serious about being one of the safest hospitals in the UK, then you've got to do things differently. And you can't do that by just adding on to the day job and saying, can you stay a few hours later tonight, or can you do... No.
It can't be something that's got a 9-month cycle. For us, this is the way we'll be working for years and years. And I think that's really important for the staff to hear that message, that this is about the staff.
Watching the chief executives over the last period, it's clear that they're embracing a new way of working, moving from being problem solvers to coaches and giving their teams the time and the space to come up with their own solutions. At a national level, through programs like this, we're learning more about our own approach in how to support organisations being successful in this kind of work.
Having been involved from the beginning, I can see that the leadership has taken this on as something that's become embedded. It's become part of the way we do things around here. They have been completely committed to this.
We're learning to trust our workforce to make those changes, and they are doing an amazing job.